सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्. This is the civilization in which we all belong, the Indian civilization, which wishes good and good health, happiness for all. Friends, when today we are facing a pandemic of COVID-19, when the world is absolutely affected by this pandemic, it is very important for me and you and all of us being a medico to be responsible, to understand our responsibility and at least make sure that we are aware with the basic information so that we can save our near and dear ones, and also if needed we are ready to serve the society and patients. Friends, as you know, there are so many messages, so many videos being circulated, so many informations in the media, social media, etc., giving you information about COVID-19. But it is very important for you as a MBBS student to understand what is authenticate medical knowledge about COVID-19. So today we will discuss in brief about the basic signs and symptoms, that is clinical features of COVID-19. Friends, when Wuhan was stuck up with this COVID-19 infection, no one might have thought that the world will have a temporary pause because of this COVID-19 infection, because the severity of it is as high as the Spanish flu which occurred in 1920. So, what are the presenting clinical features with which patients will come to you? Or in simple words, let me tell you that what are the things which patients or your near and dear ones, if at all, get infected will complain. So it is very important for you to understand all the basic clinical features, signs and symptoms. So, there might be few classes of the patients of COVID-19 who might be absolutely asymptomatic. They might just complain of minor, mild symptoms, that is body ache, fatigue, weakness, etc. also. But what are the classical clinical complaints of patient? That is high grade fever, sore throat and dry cough and breathlessness. So these are the common constitutional symptoms: fever, sore throat, dry cough and breathlessness. It is not necessary that every patient will have the classical complaints, but there might be atypical complaints also. But generally, a patient of COVID-19 might have any of these four complaints, that is fever, cough, breathlessness and dry cough. Also, what is very much important and alarming is severe weakness and fatigue. Weakness which patient would describe as without working patient is so weak that patient is unable even to stand from the chair or stand from the bed. So severe weakness, along with severe weakness and fatigue, there might be acute joint pain. So sudden onset of acute multiple joint pain can also be one of the clinical complaints of the patients of COVID-19. Also, we have seen in our setup also many patients of COVID-19 who presents as a cardiac patient or might have a typical cardiac complaint. So we need not to be overconfident if a patient is complaining of chest pain, of palpitation, of perspiration, to be purely cardiac and neglect the safety precautions. So these days various COVID-19 patients are also presenting as typical cardiac cases, and we have seen it at our setup also. So we have to be careful in and each and every of the cardiac patients too. Also, what we have to see is that other atypical complaints are gastrointestinal complaints, like patients can complain of severe acute abdominal pain and diarrhea. So, diarrhea and abdominal pain is also one of the atypical features of COVID-19 infection. So, acute pruritus is also one of the complaints which patients would complain. That is sudden onset of itching and redness in the skin all of a sudden without a triggering factor could be a possible complaint of patients of COVID-19. Also, two complaints which are very much talked about these days, that is the loss of smell and loss of taste. So we see in various cases of COVID-19 positive patients would complain that when they eat they don't get the same taste or they don't get the same smell or the intensity of the smell and taste is decreased. So patients can complain of loss of taste and loss of smell. So these are the typical clinical scenario which patients will complain. Other complaints would be patient feeling uneasy or patient feeling a bit weak. So if at all if a patient is in contact of any positive case or is having a travel history, and now travel history is not that much relevant because COVID-19 has spread to each and every part of our country also. So, but still, one need to ask about the travel history and the contact history with the COVID-19 patients. If at all, everyone should be advised around us to download the Arogya Setu app and see if there is any contact tracing of a positive patient. So, it is very important for the for us being medico to take history of the contact tracing and also know the travel history. So this is the typical clinical scenario with which patients can present. But a severe case of COVID-19 will present with acute breathlessness, a typical case of ARDS, so breathlessness, he is gasping, there will be air hunger and also typical fever, cough, etc. So all such cases needs to be given absolute attention in an intensive care unit and treated accordingly. So if at all you are asked in future to serve our society, it is very important for you all to know what are the clinical signs and symptoms which are commonly felt for the patients of COVID-19. If at all not so, let's hope that none of our near and dear ones get COVID, but in case if they get, you can guide them. So being a medico, being a MBBS student and being into a noble profession, it's your and my duty to serve our family, friends and near and dear ones along with our society. So I hope you are clear with the clinical features of patients of COVID-19. Stay safe, stay healthy. Thank you.